in the urban family. Our moderator, Marion Phillips III, Senior Vice President, U.S. News World Report speakers. Our participants, New York State Senator Cordell Cleare, Chair Committee on Aging, and New York Senator Samra Brouk, Chair Committee on Mental Health. If all guests can please come back and take our seats, our fireside chat is beginning.
Well, where are we? Good morning, everyone. As we wait for everyone to come in and get situated, I'm just gonna let you know how little disturbed I am that they sent each other a memo. They claim they sent me the memo, but used it, yeah, another lady over there got it. But I didn't get the memo. But I think it's appropriate for our conversation that they're wearing a color orange that represents happiness, represents joy, and represents opportunity. And I think any public official, elected official, who sits in a space of changing policy needs to be more proactive and positive and not always reactive in a negative way. So maybe we can get some people who are running for president who are from Florida and Ohio to start wearing orange. Y'all will get that later. But again, good morning, and I'm happy to be here. Here at U.S. News and World Report, we have a product called Healthiest Communities. And Healthiest Communities really highlights where we are as a country. Our first keynote speaker really gave you a lot of data and a lot of Healthiest Communities and deals with the social determinants of health. And when you understand that, you really get a deep dive into how the lack of access to grocery stores, the lack of access to green space, the lack of access to housing. And I'm not going to say affordable or market rate, I'm going to say livable, because there can be houses and apartments that are not livable, and too many of us live there. Access to quality education, access to quality health care. And when you look at Healthiest Communities, you should go to our website, usnews.com, and you do a deep dive into Healthiest Communities. What you will discover is something very disturbing. Manhattan has some of the best health care in the world, but not everyone has geographical access to it. So making it available, and you can't get there. We have some of the finest housing in the world, but if you cannot live there. And so I raised that as just a laying a foundation to a larger conversation dealing with mental health and dealing with senior care and senior living, because they go together. And so I'm going to start off with thanking both of our senators. I am very parochial. I want to start off with Senator Cleare because she's from New York City and this is her district. So we're going to do two things. But because Cordell is so kind, we're going to let Senator Brouk go first. So tell us, when you look at your role as a senator and you look at how mental health, specifically with young people, and I want to start there. We're just going to do a generational walk from young people to seniors. How do you look at this crisis? What was your trigger point? Was it COVID? Was it something from the civil rights movement? Was it bloody? I know you're not old enough to remember Bloody Sunday, but in a history book. But was it a trigger point? Was it Simone Biles backing out of a world championship saying, I can't do this anymore, or the Olympics, I can't do this anymore? So what was your trigger point and what motivates you to keep moving on this subject?
Great. Thank you so much. And thank you, Senator Cleare, for welcoming me here to your part of New York. And obviously, thank you to Lloyd and the Chamber and all of the partners for putting this together and to bringing me down here from upstate in Rochester, New York, if anyone's ever been that far up. It's gorgeous this time of year, just don't come in the winter. So again, I'm Senator Samra Brouk. Like I said, I represent upstate Rochester, New York, the 55th District. But for today's discussion, I chair the Mental Health Committee. And, you know, I think the perfect entry point, and to answer your question, is how I even got to be the chair of this committee, because it was very much informed by what I was witnessing all around, not just my district, but communities all across New York and probably all across this country. So interestingly, you know, there was not a mental health committee in the state Senate. So it was partnered with something else. It was intellectual, developmental disabilities, and mental health, all wrapped into one committee that was meant to do all of the legislative work on those topics, all the budgetary, you know, advocacy. And I came in, I was elected in November 2020. And one of the things that I noticed, and we've heard this as a theme throughout today, is that no matter who you were, where you were from, how much money, how much access you had, how much privilege you had or didn't have, wealth, education, it didn't matter. I was hearing that people all over our communities were struggling with their mental health. Remember, I was running for office in the middle of a global pandemic in 2020, and I had a district that was urban, suburban, rural. I represent, you know, 3 out of the poorest 5 zip codes in New York State. We heard about struggles we've had with our young people in our education system in Rochester. And I also represent some of the wealthiest communities in the county that I serve. So it says something that all of these individuals were sharing with me, a political candidate, right? This was, you know, via phone and texts that I was doing trying to get votes. People were sharing with me that their biggest challenge was mental health. And so when I, you know, eventually won that race and went to look at which committees made sense for me to be a part of in the Senate, I noticed that there was not a mental health committee. And I wrote to the majority leader and expressed that I thought this was I think that this was a prudent thing to do, was to create a mental health committee, and I thought I would be a great chair for that position. And she is such a wonderful leader, a brilliant leader, and she agreed with me, so I'm very grateful. And so that's really how I came to chair this committee, but it's because of these different, you know, determinants of our health, right? Global events, the things that are happening both personally in our communities, but also globally, all affect our ability to show up at work, our ability to excel in school, our ability to even just show up in our lives, right? At the time, I was not a parent. Now I have a 2-year-old daughter, and I have to show up for her every day and bring the same joy she brings to me. It doesn't matter if I had a hard day at work, if it's a stressful week, right? We have to show up in those ways, whether it's personally or professionally. And so that's really how I came into this work. And as the chair of Mental Health Committee, there's been 3 major priorities to touch on those topics. And then I'm going to hand it over to Senator Cleare, because I could talk all day about mental health, as she knows. But she still invited me here, so thank you. No problem. And it was really these 3 major topics. It's 1, what are we doing in crisis moments? So we understand as a state we have divested from our mental health sector. We do not have the people, we don't have the workforce, we don't have the literal facilities, we do not have what we need to meet the moment. And so unfortunately, more people find themselves in mental health crisis. So 1 is transforming how we deal with mental health crisis. The 2nd is our workforce. You heard about it today. We have a stagnant workforce that hasn't seen increases in their pay. They're leaving these jobs that are very difficult emotionally and physically, and they're going to go for jobs that will still support their families, but aren't nearly as grueling. And we have to recruit, retain our workforce, and diversify our workforce. And the 3rd was youth mental health. It was very apparent that, you know, youth specifically, in the moments where their brains are rapidly developing, if we do not intervene during that development, that's going to compound, right? And we are going to end up with adults with even more severe mental health challenges and mental illness. And so we have to look at what interventions we can take now for a generation where some of them, their first few years, in school or would have been in school were in a pandemic, right? How many toddlers were delayed because they literally hadn't been spoken to, they hadn't socialized, right? They weren't allowed to be out in this world dealing with loss and trauma. And so, so that's the third priority that we've put forward for the Mental Health Committee, and we'll dig more into that later, but I want to hand it to my colleague here in matching outfit.
So, Senator Cleare, your question, so we're just going to have 2 opening questions, and then we're going to participate in their conversation. That is our goal, okay? Your opening question really is, American First has come forward, and many, even OMB from the federal level, have all agreed on this, which is it is cheaper for people to age at home, especially when you think about it from a mental standpoint. If you can keep people in their homes, there is a familiarity for them. There's an opportunity for them to continue living a life that they have learned and memorized. But yet, Medicare, Medicaid will not cover that. So what from that standpoint, what can we do? How do we help our seniors who are the backbone, the foundation, and in some cases, still the babysitter in our communities?
Well, first, I wanted to thank Lloyd for convening this very important discussion today, and thank my colleague and sister, Senator Samra Brouk, for joining us here today. I want to just partly answer the question you gave her too, which relates to this. I had the privilege, and I tell people it is a privilege when you can do this. I had the privilege of caring for both of my parents before they transitioned. And that was very informative to me on what the challenges are for people who are aging and how we age, and especially Black people aging, and how we get through that process. I saw the challenges of care, the challenges of benefits, and it was just very, very, very alarming to me. And I often said, I wonder what would happen if my parents didn't have me. And furthermore, if I didn't have the ability to give the kind of care that I could. And it was a challenge. That wasn't an easy thing to do. There were sacrifices, work sacrifices, career sacrifices, exhaustion at some times, but I was able to do it to take care of them. So that is what really makes me so passionate about the work that I am doing for our aging population. One of the ways that we can make sure, and I do believe that I agree with the conclusion of the study, that people should remain at home for as long as they possibly can. Usually when people go into an institution or facility, there is a level of isolation that occurs. That in itself is harmful to their health. I have fought to bring funding along with my colleagues to make sure that we're supporting NORC communities, naturally occurring retirement communities. There are so many people who are aging and getting older. A lot of our civil service workers and others who have served their state and their city are now older New Yorkers at home, and they need support. So we guaranteed in this year's budget funding to make sure that there are nurses in all our NORCs, that they're staffed with nurses. I have to agree with my colleague Samra Brooks. When it comes to aging, we also have to make sure that we are supporting people who care for our aging. We have to have fair pay for home care. We can't even get people to want to go into that profession and go into that career because it doesn't pay. If you can't make enough to take care of your own family, what sense does it make for you to go out and take care of someone else's for such minimal pay? So we... And again, that affects the Black community very deeply, and it also, it's hard work. It is hard work, and people who do that kind of work, it's never just a paycheck. There is a level of care. I know home care workers who went out during the pandemic, left their families, rode the subways, took the risk, because these people were literally depending on them, not even just as health care, but company and companionship. So that's a very, very important issue that I think that we have to look at. And we also have to increase eligibilities for certain benefits, when you look at so many people who don't qualify for Medicaid and Medicare, there's such a stringent eligibility, it's ridiculous. It's not even realistic, the amount of money that you would have to make to qualify. So we have to look at those and those income levels and really make them more realistic so that more people can qualify for Medicaid and Medicare. There has to be something that is available. I've literally, as a senator, sat in my office and just struggled with someone who made $5 over. $5 over the income. We have to find ways to make sure that we're subsidizing that cost. And lastly, we have to shift from the institutional care model, and we have to stop looking at profit margins and look at people.
So, both of you threw out a very important issue related to staffing and capacity. You didn't say it exactly, but the reality is we're somewhere around 200,000 doctors short, nurses short. I forget the nurse number. Home attendants short, mental health providers short. We are talking about a serious issue, and over the next several years, not decades, because we're short now.
Right now.
Next several years, we should see a greater problem. How do we address some of that?
Okay, I'll go first. One of the things we need to do when we talk about nurses especially, and this is something that I did as a pilot program with the New York State Senate, and I'm very thankful to our leader, Andrea Stewart-Cousins, who allowed this initiative to go through. I have a nursing home in my district. I cover the Upper West Side as well. I have Jewish home care. What they have there is a program that takes high school students and begins training them. And they go through a program, and by the time they're done, they have their CNA certification and the guarantee of a job. Because that's the thing that we need. We need money too. All these things are relative. And they recruit primarily from one of my housing developments, which is Douglas Houses on the Upper West. Absolutely, all these things are relative. And we have to think about that and look at those approaches. Now, we've had several cohorts of these young people graduate because not only hospitals need nurses, not all schools need nurses, nursing homes need nurses, and of course, everybody's just pilfering where they can get them from. So we have to create that pipeline. We have to make sure that young people know that there are careers. Some of the cohorts that have graduated already are now studying to be technicians. They're going on into the healthcare field. So this is a situation that requires us to look at every angle. We have to look at how we're educating young people. We have to look at how we're creating opportunities in our own communities, bringing our young people in. When I go to their graduations, it brings tears because it's just a win-win all around. The young people are so happy to be participating in such a positive way, being able to do what they do. They care for these older people. Our older people are just happy to have the young people around. You know, everybody's got all their cell phone issues settled. And, you know, it's a really shared advantage to have the program. So this is the second year that the Senate has funded it, and we are looking to get more funding and perhaps spread this program to other facilities. But right now, we have graduated several classes, and they are literally working in other nursing homes throughout the state. It has become a very successful pilot. We have to continue to do more and more programs like that.
Yeah, I couldn't agree more about especially being able to pilot something like that and then bringing it statewide. I think, you know, I was thinking of a few things that we've been looking at specifically around workforce, and one of them is, again, meeting the moment that we're in, which calls for creativity, which calls for really examining what exists and what we may need to change to meet the needs. Because, you know, I think a lot about, someone who is, and I always think children, just because literally their neurons are producing and reproducing at such a rapid rate. To be honest, most of us in this room, ours aren't reproducing anymore. There's not that many new, connections. But, obviously as adults, we have mental health challenges as well. But when you think about children specifically, if you don't get them in those moments, their brains develop around that trauma. And so I always think about that. You're right. We can't wait 5 years to say, oh, let's try this thing in 5 years and, we'll just start taking steps towards it. We need change now. So things like doing these pilots are a quick way to show what works and a quick way to figure out where we should fund. Some other things that I've been looking at specifically around mental health, one of the first things was when I came into office in January 2021, you gotta imagine, I'm excited, I'm ready to fight, my millennial energy, here we go. I'm gonna, hit glass ceilings, all of it, right? And I said, I can't wait to fight. I'm gonna fight for all this money in the budget. I assume everyone would agree with that, because who wouldn't wanna invest in mental health? We all see the challenges. Our Surgeon General said we have a youth mental health crisis. And what I learned quickly was that actually my job in the budget was to try to fight back for all the cuts that were actually coming. And that was one of those moments where you kind of it's like you ran into a wall when you're new as a legislator. And I learned for the first time that it had been over 10 years since we gave so much as a cost of living adjustment to our mental health workforce.
Right.
Just think about that. Now, I come from the private sector. I worked in the private sector before I was in office. And if 10 years had gone by without so much as a cost of living adjustment, raise your hand if you'd still be in that job.
That's right.
Nobody raised their hand.
No.
For anyone watching this, no one raised their hand. It's nearly impossible to keep up with your expenses. It's nearly impossible to continue supporting your family. And so in 2021, in that budget, we got the first cost of living adjustment for this workforce in over a decade. Now, the best part of that is once you do that once, we then, every year since have been able to secure a cost of living adjustment, including a year where the governor put forward over 5% of an increase. It's never as much as we need, but it's making up for, again, a decade with nothing. So when we think about recruiting and retaining, even keeping our workforce, we have to keep the people we have and bring more. I think, the COLAs, these cost of living adjustments, being mindful that a lot of these jobs are not paying livable wages, I think that's a big piece of it. I think another big piece of this is identifying barriers that exist to getting more individuals in these, into these professions. So one of these examples is in Illinois, they looked at the data of social workers who, again, so if you're a social worker, you've got your master's, you're a mental health professional, and looked at the data of who and how these master's students were passing the licensing exam. And what they found is that Black students who had all the same education as non-Black students, less than half of them were passing this licensing exam, and over 80% of white students were passing these licensing exams. Now, when you have data that stark, that's not an individual issue. It's not because maybe someone struggled through their master's programs. These are qualified people. They've done their clinical work, right? They've done their hours in clinical training. They've gotten their master's. They've got their degrees. And so what Illinois did was they changed the path through which you became a master's social worker and were able to go out and work. So they increased clinical hours. They looked at alternative paths that still allowed for the qualifications, but also really scrutinized these licensing exams that were clearly providing disparate impact on getting more people of color specifically. So Illinois has already done that, and they've had thousands and thousands of social workers coming online who now can practice and serve the young people, the seniors, whoever needs that help. And so we've introduced similar legislation in New York State, but other states are catching on that we have to keep the level of care and the level of licensure and professionalism up high, right? I mean, when you step into an office, you want to know that the person that you're going to is qualified. Absolutely, and especially for a young person. Listen, I want to see all your credentials if you're going to talk to my baby girl, right? I want to see your degree. I want to make sure that you did, your hours and all of that. And that maintains. And within that, let's also really investigate the fact that a lot of things in this country have not been created with Black people in mind. And the cultural competency that comes with that, the linguistic competency that comes with that. So that's another thing I think we look at, is how to really look at these barriers. And the third thing I'll say is, specifically with youth, we started a youth mental health advisory board. We're actually we're looking to do one statewide as well. And one of the things that youth talk about a lot is wanting to talk to their peers. So many of them don't necessarily want to talk to us, or adults or teachers, or even a psychologist or a social worker. They actually get a lot of value from talking to their peers. And so we see similar things with individuals, with substance misuse disorder, people with mental illness, that talking to someone who has been in your shoes can sometimes be the way you build trust to get you in the door. And then maybe you're talking to a psychiatrist. Maybe then you're getting on a treatment plan. And so in New York, we've done some work with centering peers and certifying these peers to be working in these facilities. And we've seen tremendous results all over the state. And so now we are working to, how do we create some uniformity across the state so that people who have gone through these things, who can go through a certification process to be certified peers, are then also employable and earning a livable wage, because they can fill so many of these positions. Of course, not the social worker or the clinician positions, but they can be kind of that face, that opens the door, that picks up the phone to help people get on their path. And so these are all the things we're thinking about, of how do we create, almost this patchwork of solving the workforce shortage.
Not really.
Okay, then let me ask my question. Both of you mentioned the pathway. Both of you mentioned a great pilot idea, or you mentioned a pilot idea program. What we need to understand is everyone in this room is also part of that pilot program. As you said, show up for your child. We must show up for every single Black, brown boy and girl, not with our title or our fine cars or who we think we are.
That's right.
We need to show up and mentor and sponsor and teach.
Absolutely.
So that they understand what all these jobs are.
Yep.
To that point, pilot program is essential, especially if we do not expose young people at the high school level of what careers look like. Because when you start asking them, what do you want to be when you grow up? What are you going to do? What are you going to major in college? Blank look. The blue screen of death, right? Mm-hmm, mm-hmm. You'll run into that in 14 more years. Go ahead.
No, I think you're absolutely right. And this is why I'm excited about the pilot that I'm involved with, because, if you ask somebody when they're graduating, what are you going to college to do? It's too late to be having that conversation. Here is something that we can get our children involved in as teenagers, as early as being freshmen and sophomores, and it'll be something they have that they can make money whether they decide to go to college or not, or whether they decide to continue in that field or not. So I think we do have to get to our young people earlier for all the professions that we want them to be in, because they're not necessarily exposed to what is available, what they can do, where they can go. There are a ton of careers in health, and there are a ton of directions that they can go in that would be good for them, help them make a living wage. And the other thing I just want to mention, too, there is a need for cultural sensitivity and cultural awareness in the workforce as well. I talk to seniors all the time, and something as simple as language, someone preparing meals for you that may not know how to make things that you eat, or may not understand the customs and the cultures, all of those things are very important to have people from our community be involved. And yes, we have to show up. I show up for my church members. I show up on my block, I mean, I'm forced though. My mother kind of did that to me when I was young. So now all these people are like, yeah, you know, you're supposed to do that for me. So I call and I check on people. Are you all right? Did you eat? Do you need something from the store? All of these things are, it's what we have to do, and we have to inform and help. Some of our seniors, older New Yorkers, need our help. It could be just filling out an application for something, you know, learning how to, you know, navigate through these systems, press this for that, and press, you know, that may seem simple to you, but it's hard for some of our seniors to do that. So yes, we do have to show up for them. And remember, the aging especially, sometimes we forget, they are people too. And they're very special people. They have served, they have raised children. As you mentioned earlier, some of them are still raising children. They are the backbone of our community, and we have to make sure that they're not isolated, that they're not alone, and the role that they've played all their lives as these strong people, now they're a little vulnerable and they need our help.
So let's go.
And guess what, Marion? If we're all lucky,
We're going to get old.
we're going to be older New Yorkers too.
And, you know, I appreciate you said if we're lucky. So what am I now? All this gray hair. But here's our last discussion point. AI is here. AI corrects half of your conversations on your phone and sends the wrong message. AI is here.
Yeah.
All you need to do is make a phone call to Con Ed, and before you speak to Billy or Betty, you're speaking to press 1. Yes. If you speak English, press 2. AI is here. AI has some positives in terms of a triage for mental health, a triage for seniors. However, AI does not speak all of our language because we don't all have the same capacity to function within AI. Now, this is my question, and when you dig deep into AI, especially in communities of color, AI, remember, it aggregates just data every second. It just aggregates data. If we are not part of that, and we do not accurately describe who we are, biracial, Black American, Black Hispanic, Black African, understand, all those DNAs are different. If we do not identify correctly, AI is going to be off and play catch up. And the people who will be affected most are us. So you all figure out the question and answer the one you like.
I'm gonna go deeper than that. If we're not involved in the creation of these systems, we're gonna be left out.
That's correct.
And yeah, and that has already begun to happen, where we are left out, and it's very frightening because AI is just AI, but it's feeding off of a human intelligence and a human thoughts and ideals. So we have to get into the very heart of it to make sure that we are not just automatically out of it. Now, I'm looking in the audience and I see Jay Shell Walker, who used to be a member of my staff, and I'm remembering an AI event that we did that was really good for our seniors, right? NYSOFA, the New York State Office for the Aging, I try not to do acronyms so that people make sure people know what I'm talking about. They had a program where you can get an AI pet. And I was like, an AI pet, you know? So, you know, I said, bring me some of those to my office. Let me see what you're talking about. And they were bragging about it and talking about how, you know, they had taken it to hospitals and institutions, and they visited a young lady, came back, and the whole pet was red. And they asked the nurses what happened. They said she kisses it all the time. She kisses. So they have a dog, a cat, and a bird. And these pets are so popular, I had no idea. I started offering them to the community, and they came to pick up. We did a thing at the Kennedy Center. They came to pick up their pets like you come to pick up children, with clothes, with outfits, with names. And many of them have stayed in communication with me. They love them. And they love the pets. It provides companionship. Listen, hey, this is the dog you don't have to walk. but it barks, it responds to petting, and it does different things. We can do a ton of stuff. I don't want to digress.
That's
we
a
can
very
do
good point. That's
yeah.
a very good point.
We can do a ton of stuff with AI, but you got to have the mind to do it, and that includes us being at the table on every level. And one thing I don't want to leave here without mentioning that's very critical to both the topics we talked about, and that is affordable housing. We cannot be well if we are not housed. We cannot be cared for if we are not housed. And when you look at older people, aging people, people with mental health, whatever it is that they're suffering with, older people, your income generally does not go up. But rents are soaring to incredible, astronomical heights. And we have to be very careful that we are planning for a future that is going to be able to take care of our older New Yorkers, as they are the fastest growing population across the state. And we have to have somewhere for them to live, or else we're going to have a real problem on that. And that affects their mental health because they're stressed out about it. I talk to seniors all the time between housing and something we didn't get a chance to talk about, which is the cost of prescription drugs. They are making horrible, life-threatening decisions to take, instead of a pill a day, I'll take my pill every other day. People are cutting medicine in half. This is not the way we're supposed to live, and this is not the way we honor our seniors. I currently have a bill, I just have to say it, and I hope that I can push it further this coming legislative session, but asking that we are able to get permission, at least for the top 5 medications. My seniors are able to get those from Canada because the prices are so much cheaper. But there are barriers in the way from allowing us to be able to do that here in the United States, and we have to move some of those barriers because, it's profit once again. Big Pharma sells this medication at prices that my seniors cannot afford. So those are the last 2 things I want to talk about: housing and prescription medicine.
Senator Brouk?
Where do I go there, Senator?
We're going
Cleare,
on.
that
We're
was
going
her
on
whole
AI.
platform.
We're staying on AI. Remember,
Well,
my job was to keep us together.
Yeah, you kept us together. I promised you we wouldn't, though. Well, as anyone could expect, I could not agree more with everything that Senator Cleare said, and it's a privilege to be able to see her do that work in Albany and advocate for all of us in this room, and to be her sidekick on some of those bills, also known as a co-sponsor. But when it comes to AI, and I say this as someone who worked in the technology sector before coming into office in a number of different ways, and what we found is that technology, as we know, I mean, look around, right? We're streaming right now. Technology is absolutely necessary. It's going to continue to grow and expand. And we have to continue to grow and expand with it. In other words, we have to be at the table to learn about what AI is, right? One of the things that concerns me overall is that when you talk about government's role in looking at how AI can be used responsibly, we have to better understand it. You cannot legislate something that you do not understand. And so even if you don't have a background in technology, how are you getting that background? How are you finding, trusted sources to learn about the best way to kind of curb this expansion? Because I believe that it can do incredible things. I do. And I will say, I've actually talked to a number of companies who are finding ways to use AI specifically with mental health. And it is incredible. And it is reaching people who cannot find services otherwise. But we also know that to just run, and this does go to the profit-seeking piece of it, right? To just run seeking profit without the checks and balances of the power AI has, especially on communities of color, we are going to find ourselves in the same situation we find ourselves with so many other sectors, where people of color are an afterthought. We are not considered. It does not serve us in the way that it needs to serve us. And oftentimes it can even hurt us. And so, yes, you knew where I was going. Oftentimes it can even hurt us. And so we have to be incredibly focused and serious about how we are handling that expansion. And I do think that government has a role to play.
Absolutely.
In educating ourselves and making sure that we're looking out for our constituents, that we're looking out for our communities, which are the folks that are sitting in a room like this, or at work and on the sidewalks. Everyone you talk to is our community. That's who we represent here in New York, and we have to make sure that those needs are also being taken into account and that we're not being taken advantage of. So I think that there's no fighting. As you said, it's here, it's happening, but who creates it is who gets reflected in it. And so not only do we need to have, folks working in tech spaces,
Yes.
and we need to diversify that, we also need to better understand how it can help and how it can hurt and have very honest conversations.
Absolutely. It's a power.
Close us out. It's your district.
No, it's a power that you have, and I'm tying it into some of the conversation I caught earlier about young people and cell phones. And I look at social media. What a great tool. What a great thing. What a wonderful thing, but it can also be an evil thing. And it can be a difficult thing. We don't use it right, and we don't monitor it properly, and we don't put the right messaging. So, a lot of the times these things get out of the gate because of profit and money, but we have to catch up to it because it's uncharted territory, and we don't know exactly what the impact and the result is going to be on our community. Why? Because we're not at the table. So this is just another area in which we have to push and insist that we have our experts at the table and that our needs and concerns are taken into consideration when these things are being planned.
Let's give a hand to both senators. Let's also give a hand to all of our speakers today. I just want to give a thank you to Lloyd and to the entire Greater Harlem Chamber of Commerce for allowing us to partner with you to bring this important information to all of us in the public. At U.S. News, our motto is very simple: helping people make life decisions. In order to do that, we must have programs like this, these types of convenings. We must have access to this information. And I just want to encourage you, I'm going to do a cheap plug. usnews.com has everything from our news to our health to our travel to our education. Understand, it is a tool, it's not the outcome. So please look at all sources, synthesize all those sources, and be the most informed public for what these two senators said. They talked about opportunities from a policy standpoint. Our other speakers were very clear, but if we are not informed, the problem still exists. So thank you very much. Thank you, Lloyd. Thank you, Greater Harlem Chamber.
Please give another round of applause for our moderator and panelists, please. Now welcome Mr. Winston Majette, Executive Director of the Greater Harlem Chamber of Commerce.
Thank you all for coming out to the 2024 National Urban Health Conference. As was just said, this event is being recorded and will stream on our website, www.harlemweek.com, to tens of thousands of people throughout the month of August. So please visit www.harlemweek.com so you can find out more not only about this conference, but also the other health events that the Greater Harlem Chamber of Commerce and Harlem Week, celebrating its 50th anniversary, is doing. We'll be having a climate change conference on Wednesday evening, August 7th. We have our New York City Senior Citizens Day all day on Friday, August 9th. On the 10th of August, we have our Percy Sutton Harlem 5K run and children's run. And we'll have a walk for some of you who just want to walk that walk and be healthy. On Sunday, the 11th of August, we have a great day in Harlem at Ulysses S. Grant National Memorial. And on August 15th, we have our Black Health Matters Conference. And on Saturday, August 17th, and Sunday, August 18th, we have our two-day New York City Children's Festival. And on our biggest day, Harlem Day, On the 18th of August, we have our Harlem Health Village. So make sure you come out for our other health events. And we thank again all the partners that were involved in this event. The speakers today, the City College of New York, Padmore John, chairperson for the GHCC Health Conference, Dr. Fergus from Mount Sinai. We also thank our Healthy Aging panel, our moderator, Ms. Singh, our panelists, George LeConte, Greg Ho, Ryan Murray, and Meredith Oppenheim. We also like to thank our other keynote speaker, Chancellor David Banks of New York City Public Schools, and our mental and emotional health and well-being of our children post-COVID panel and moderator, Dr. Destiny Price, moderator, panelists, Dr. Verisanthan, Dr. John Palmer, and Dr. Green. And of course, this great fireside chat that you just witnessed, which was hosted by Marion Phillips of U.S. News and World Report, and its participants, New York State Senator Cleare and New York State Senator Brouk. So once again, I'd like to thank our partners. Hi, Senator. She's going to share something about health with you.
No, actually. Well, it is about health, too. I believe arts and culture is very important in our community and preserving that. So in that vein, I have my second annual Afro-Latino Jazz celebration and festival in Marcus Garvey Park on August the 9th. Please come out and participate at 3 o'clock. These cultures are so intertwined, and it's so good for us to continue to celebrate the music. And then on August 28th is my annual National Senior Citizen Appreciation Day on the plaza of the Adam Clayton Powell State Office Building at 125th Street and Adam Clayton Powell Jr. Boulevard. That's going to be starting at, Dwayne, help me, 12, thank you. 12 o'clock in the afternoon, and y'all usually tell me when to stop, which is never. But it's a great day for us to come out and celebrate our seniors, and they have a great time, and we provide all of the services, all of the healthcare providers are invited, all of our cities, federal, state agencies are there in person, which is the way older New Yorkers like it. They like to be able to be face-to-face, able to talk to people from NYCHA and HPD and DACR and the Comptroller's Office, and it's a great day to come out and just celebrate our older New Yorkers. August 28th, people, please come out and join us. Thank you.
Thank you, Senator. Partners today were our presenting sponsors, the Greater Harlem Chamber of Commerce, U.S. News and World Report, the City College of New York, sponsors, West Harlem Development Corporation, New York City Health and Hospitals Harlem Hospital Center, Mount Sinai, Columbia University, Amazon Access, Harlem Week's 50th, Celebrate the Journey. Co-sponsors, West Harlem Innovation Network, New York State Senator Cleare, who you heard from, New York City Public Schools, and media sponsors, AM New York, the New York Amsterdam News, and 1010 Winds on 92.3 FM. So meet somebody who you had not known before you came here. Make sure that you find out how you can help them and they can help you. And again, have an enjoyable day, and thank you for coming out to the 2024 National Urban Health Conference.